So the treatment of amyotrophic lateral sclerosis. So in the treatment of amyotrophic lateral sclerosis, no treatment arrests the underlying pathological process in ALS. So there is no treatment which arrests the underlying pathological process. So the drug Riluzole. So this Riluzole is 100 mg per day. So this was approved for ALS because it produces only a modest lengthening of survival. What is the drug? Riluzole 100 mg per day was approved for ALS because it produces a modest lengthening of survival. In one trial, the survival rate at 18 months with Riluzole was similar to placebo at 15 months. So in one trial, the survival rate at 18 months with Riluzole was similar to placebo at 15 months. So what is the mechanism of this effect? It is not known. But Riluzole, it reduces excitotoxicity by diminishing glutamate release. So what is the mechanism of this effect? Riluzole, it reduces the excitotoxicity. It diminishes glutamate release. So Riluzole is generally well tolerated. Only the side effects are nausea, dizziness, weight loss and elevated liver enzymes occur occasionally. So this Riluzole is well tolerated. Nausea, dizziness, weight loss and elevated liver enzymes may occur occasionally. So what is the second drug? First drug is Riluzole. Second drug is edaravone. So this also has been approved by the US Food and Drug Administration based on a single 6-month study in a highly selected ALS population. So this demonstrated a modest reduction in the trajectory of worsening on an ALS disability scale. Survival was not included. So this second drug is edaravone. So a 6-month study was done. So this demonstrated a modest reduction. So this drug, it is believed to act as an antioxidant. So this drug is an antioxidant. So this is administered monthly 10-day series of daily intravenous infusions. Monthly 10 days daily. So recently we also have one more, the combined oral administration of phenylbutyrate and tauroursodiol. So they also were reported to slow progression and prolong survival in ALS. So what is the other combination? Phenylbutyrate and tauroursodiol. So they reported to slow progression and prolonged survival in ALS by improving the function in mitochondria and endoplasmic reticulum. So how this is known to slow progression? By improving the function in mitochondria and the endoplasmic reticulum. So in the absence of a primary therapy for ALS, a variety of rehabilitative aids may substantially assist. So there is no primary therapy. So because of this, rehabilitative aids are important. So foot drop splints, what does they do? They facilitate ambulation by obviating the need for excessive hip flexion, and they prevent tripping on a floppy foot. Foot drop splints are used. Finger extension splints, they can potentiate the grip because muscle weakness will be there. So this finger extension splints, they can potentiate the grip. And respiratory support may be life sustaining. Long-term ventilation by tracheostomy, positive pressure ventilation by mouth or nose provides transient weeks to months relief from hypercarbia and hypoxia. So if there is a respiratory muscle weakness, a patient has to get relief from hypercarbia and hypoxia. So this can be done by long-term ventilation by tracheostomy or positive pressure ventilation by mouth or nose. Also extremely beneficial for some patients is a respiratory device, a cough assist machine. So this produces an artificial cough. So this artificial cough machine, this is highly effective in clearing the airways and it prevents aspiration pneumonia. When bulbar disease prevents normal chewing and swallowing, so gastrostomy is uniformly helpful. So because of the bulbar disease, if there is a difficulty in chewing and swallowing, gastrostomy is uniformly helpful. So this gastrostomy, it restores normal nutrition and hydration, and even speech synthesizers are now available. So this will augment the speech when there is advanced bulbar palsy. So in the presence of advanced bulbar palsy, so now there are speech synthesizers. So they facilitate oral communication and may be effective for telephone use. So we have this foot drop splints, finger extension splints, and to prevent hypercarbia and hypoxia, long-term ventilation by tracheostomy or positive pressure ventilation, and cough assist machine. So this will produce an artificial cough. So because of this, there will be a airway clearance and it prevents aspiration pneumonia. And then gastrostomy to restore nutrition and hydration, and speech synthesizers. So what are the different drugs? Riluzole, it diminishes glutamate release. Edaravone, so it's an antioxidant, 10-month day series of daily intravenous infusion. And then we also have combined oral administration of phenylbutyrate and taurursodiol. So they slow progression by improving functions in the mitochondria and the endoplasmic reticulum.